Good evening, students. Today we'll be discussing about the palatine tonsil. So before going to discuss about the palatine tonsil, we'll just have a note on Valde's ring. So Valde's ring is found by the lymphoid tissue. So this lymphoid tissue that surrounds the opening into the respiratory and digestive system forms the Valde's ring. So in the lateral part of the Valde's ring, there are palatine tonsils below and tubal tonsils above. So these palatine tonsils are located in the tonsillar fossa. Tubal tonsils are located close to the opening of auditory tube into the nasopharynx. Then the pharyngeal tonsil is in the roof of the nasopharynx, which forms the upper part of the Valde's ring. And the lingual tonsil is on the posterior third of the tongue, which forms the lower part of the Valde's ring. So we can see in this diagram. So this is the pharyngeal tonsil, that is called nasopharyngeal tonsil or adenoids. This is the tubal tonsil, this is the palatine tonsil, and this is lingual tonsil. You can see here nasopharyngeal tonsil, tubal tonsil, palatine tonsil, and lingual tonsil. So today's topic for discussion is the palatine tonsil. These are two in number, one on each side, almond shaped, located in tonsillar fossa. So this is also called as tonsillar sinus, which is located in the lateral wall of the oropharynx between anterior and posterior pillars of the fosses. So fosses is nothing but the connection between the oral cavity and oropharynx. So anterior pillar of the tonsillar fossa is formed by the palatoglossal arch and posterior pillar is formed by the palatopharyngeal arch. So let us see in detail about the boundaries of the tonsillar fossa. So you can see here. So this is the fosses. You can see this is the palatoglossal arch. This is the palatopharyngeal arch. So you can see here. So this is the palatine tonsil in the tonsillar fossa, and you can see this is the lingual tonsil in the posterior third of the tongue. You can see here adenoids on the roof of the nasopharynx. So now you can see here. This is the palatopharyngeal arch posteriorly. This is the palatoglossal arch anteriorly. So arch is containing the palatopharyngeus muscle, the palatopharyngeal arch, and palatoglossal muscle in the palatoglossal arch. Name itself speaks palatopharyngeus, from palate to the pharynx. Palatoglossal, from palate to the tongue. So anteriorly palatoglossal arch, posteriorly palatopharyngeal arch. And you can see this will be the medial surface, which will be characterized by the tonsillar crypts and one large intertonsillar cleft. And here you can see this will be the capsule. Capsule is not completely surrounding the tonsil, so it is present only on the lateral surface. And you can see just outside the capsule you can see the peritonsillar space containing the paratonsillar wing. This is very important surgically. So then if you go still outside this peritonsillar space, you can see this will be the pharyngobasilar fascia, and this will be the superior constrictor, and outside the superior constrictor you can see the buccopharyngeal fascia, and still outside that you can see the styloglossus and glossopharyngeal nerve. So tonsillar fossa boundaries: anteriorly palatoglossal arch containing palatoglossus muscle, posteriorly palatopharyngeal arch containing palatopharyngeus muscle. So apex is a soft palate where both arches meet. Base is found by the dorsum of posterior one third of the tongue. So lateral wall is called as tonsillar bed. We have seen in the earlier picture also here. This forms the tonsillar bed. So let us see here. Tonsillar bed from within outwards, pharyngobasilar fascia. You can see here. This is the pharyngobasilar fascia. This is the superior constrictor, and this is the buccopharyngeal fascia. In addition to this, few minor structures are also present. You can see here pharyngobasilar fascia and few fibers of palatopharyngeus muscle in the upper and posterior part. Then superior constrictor muscle in the posterior superior 2/3, and styloglossus muscle accompanied by glossopharyngeal nerve in the anterior inferior 1/3. You can see here. So styloglossus and glossopharyngeal nerve, superior constrictor. So this palatopharyngeal, from palate to the pharynx, when it is traveling, it is also in relation to the tonsillar bed. So then buccopharyngeal fascia. You can see here. So this will be the palatoglossal arch. This will be the palatopharyngeal arch, and this is the tonsillar fossa. You can see this will be the apex of the tonsillar fossa, and this will be the base of the tonsillar fossa. You can see these are the palatine tonsils. This is the palatine tonsil. So features: two surfaces, medial and lateral, two borders, anterior and posterior, two ends, upper end and lower end. So this is the tonsillar fossa, and this is the palatine tonsil. You can see this will be the upper end, this will be the lower end, this will be the medial surface, this will be the lateral surface. Anterior and posterior borders are not seen in this section. You can see the paratonsillar vein in the peritonsillar space. You can see outside this the pharyngobasilar fascia, superconstrictor, and buccopharyngeal fascia. You can also see the styloglossus and the glossopharyngeal nerve. Still outside that, you can see here. So this is the medial pterygoid muscle and the mandible, and this will be the masseter. So this will be the submandibular salivary gland. So medial surface. So this is the medial surface. The features of the medial surface are like this. It is free and bulges into oropharynx, lined by non-keratinized stratified squamous epithelium, which dips into substance of the tonsil forming crypts. So first, these crypts begin as pits. So pits are the structures which are seen on the surface. So these pits, which they will open into the mucus-lined tonsillar crypts, which will be 12 to 15 in number. So one of the crypt is located in the upper part, and it is very large and is called crypta magna or intertonsillar cleft. So this is the remnant of the second pharyngeal pouch from which the palatine tonsil develops. So it is present only in 40% of individuals. Semillogical folds, there are two folds like plica triangularis and plica semilunaris. Both of them will extend backwards from the palatoglossal arch. If you see plica triangularis, it will extend backwards from lower part of palatoglossal arch, and plica semilunaris extends backwards from upper part of the palatoglossal arch. Both are replaced by lymphoid tissue after birth. You can see here. So this is the plica semilunaris and this is the plica triangularis. This is the anterior pillar, palatoglossal arch, extending backwards. Both are extending backwards from the palatoglossal arch, which forms the anterior pillar. So this is the posterior pillar formed by the palatopharyngeal arch. Lateral surface covered by fibrous tissue, which forms tonsillar hemicapsule. Why hemi? Because it is not completely covering the palatine tonsil. It is covering only the lateral aspect of the palatine tonsil. So this fibrous capsule is attached below to the side of the tongue. So between capsule and bed of the tonsil is the loose areolar tissue called peritonsillar space, which makes it easy to dissect tonsil in this plane during tonsillectomy, and contains paratonsillar vein. So at the same time, this paratonsillar vein is very dangerous. This will lead to post tonsillectomy bleeding. So pus collects in this space, forming peritonsillar abscess, which is called as quinsy. So relations of the lateral surface from inside outwards: loose areolar tissue containing paratonsillar vein, pharyngobasilar fascia, superconstrictor, buccopharyngeal fascia with pharyngeal plexus of nerves and vessels, facial artery with its branches, namely the ascending palatine and tonsillar arteries, then ascending pharyngeal artery. So internal carotid artery, it will be lying 2.5 centimeters behind and lateral to the tonsillar sinus, separated by fibrofatty tissue. So styloglossus muscle and glossopharyngeal nerve, styloid process, submandibular salivary gland, angle of mandible, and medial pterygoid muscle. So these are the structures. So this will be the lateral surface, peritonsillar space with paratonsillar vein, pharyngobasilar fascia, superior constrictor, buccopharyngeal fascia with pharyngeal plexus of nerves and vessels, styloglossus muscle, glossopharyngeal nerve, medial pterygoid, and mandible. Then anterior border, it lies underneath the palatoglossal arch, which forms the anterior pillar. Posterior border, it lies underneath palatopharyngeal arch, which forms the posterior pillar. Then upper pole extends up to the soft palate. Lower pole, related to tongue, continues with the lingual tonsil and is connected to the side of the tongue by suspensory ligament of tonsil. Remember this. The lower pole of the palatine tonsil is connected to tongue by suspensory ligament of tonsil. So factors keeping tonsil in position: suspensory ligament of tonsil is the main factor, followed by attachment of palatoglossus and palatopharyngeal muscles to the capsule of the tonsil, and then perivascular stalks which keep the tonsil in position. So arterial supply, first I am mentioning the inferior tonsillar branch, which is the tonsillar branch of the facial artery. This is the principal artery which enters the lower pole of the gland. Then anterior tonsillar arteries, which are derived from the dorsolingual branches of lingual artery. Then posterior tonsillar branches from ascending palatine, which is a branch from facial artery, and ascending pharyngeal artery, which is a branch from axial carotid artery. Then superior tonsillar from the greater palatine artery, which is a branch from maxillary artery. So you can see here, this is the superior palatine branch from the greater palatine, and you can also see branch coming from the ascending pharyngeal and ascending palatine. These form the posterior tonsillar, and this branches coming from the dorsal lingual form the anterior tonsillar, and this is a direct branch, tonsillar branch from the facial artery, which is forming the inferior tonsillar. This is the principal artery for the palatine tonsil. Veins drain into paratonsillar vein, and ultimately this paratonsillar veins drain into pharyngeal venous plexus. Lymphatics, These drain into upper deep cervical nodes, particularly jugular-digastric nodes. So one of the lymph node is the principal lymph node of the tonsil, which is located below and behind the angle of mandible in triangular interval between posterior belly of digastric and junction of common facial vein with the internal jugular vein. So it is primarily enlarged in the infection of tonsil. That's why it's called as principal lymph node of tonsil. So now glossopharyngeal nerve, greater and lesser palatine branches of the pterygopalatine ganglion. Then development. So this develops from the ventral part of the second pharyngeal pouch. So endodermal cells will proliferate outward as solid bud. Later these are canalized to form pits and crypts. So one of the crypt will remain large and it's called as intratonsillar cleft or crypta magna. So that is the remnant of the second pharyngeal pouch. So lymphocytes are derived from the mesoderm. So applied aspects, the most common is the acute tonsillitis. All of us might have experienced this during the cold seasons or when we eat any kind of outside food. Then acute follicular tonsillitis, where you can see separative lesions. Then bleeding from tonsillar fossa after tonsillectomy due to damage of paratonsillar vein. This is the most commonest complication of the tonsillectomy procedure. And sometimes patients will complain of loss of taste sensation due to injury to glossopharyngeal nerve. And quinsy is the formation of peritonsillar abscess. And sometimes there will be referred pain from infected tonsil to the middle ear. So this is due to glossopharyngeal nerve. Glossopharyngeal nerve supplies the palatine tonsil. It also supplies posterior method of tongue. Then it also supplies the medial wall of middle ear through the tympanic branch. Thank you. You can see here, this is the tonsils, normal tonsils. You can see this is the white spots on the infected tonsils resulting from the tonsillitis. And you can see here, this is the acute tonsillitis. You can see how enlarged the tonsils are, how much they are protecting medially. You can also see this is the suppurative lesions. So if you go slightly laterally, you can find the peritonsillar abscess. So this is the procedure where the tonsils are being removed. Thank you.